Hi class, this presentation is done by Sydney Darby, Amy Sherman, and Viviana Vasquez, and we will be presenting on the Community Health Needs Assessment Healthy Living Implementation Plan. First, we'll go over some priority goals and objectives. Then we'll talk about the progress they've made in this area and finish with ways to improve. The aim statement for the Healthy Living Implementation Plan is to decrease chronic diseases, including obesity, in East Baton Rouge Parish by creating healthier communities. The goals that are stated in order to reach this aim statement include increased knowledge of access to information about the causes of chronic disease, implementation of healthy lifestyle changes that can lead to healthier lives, increase availability, knowledge, and skills so that residents can prepare and eat healthier foods and meals, and lastly, to increase knowledge of benefits of physical activity and improve access to opportunities for physical activity. In order to reach the goals for this priority area, there are 4 strategic objectives or primary drivers. First is to increase physical activity and healthy meal preparation and consumption through a healthy family campaign. In order to meet this strategic objective, the implementation plan is to identify and address the top 3 barriers for families to being physically active in the 7 priority zip codes. Additionally, they will identify and address the top 3 barriers to adequate fruit and vegetable consumption in those same 7 priority zip codes. Additionally, they will increase the recognition and utilization of the 52-10+10 curriculum. Another goal is to create a web-based database of free and low-cost ways to be more physically active and free instructional resources for healthy meal planning and preparation. Additionally, they will create collaborative branding through the creation of standardized messaging, toolkits, and educational materials. To increase programs and initiatives to promote preparation and consumption of healthy and affordable meals, and lastly, to promote and expand Eat Fit approved restaurants and grocery stores in East Baton Rouge Parish. The right portion of this table identifies the partners associated with each of the secondary drivers in this objective. This objective relates to the overarching goal of this implementation plan because overall health will improve once barriers for physical activity and fruit and vegetable consumption are identified and addressed. Through the creation of these programs and the use of a variety of accessible promotional tools, initiatives will reach many individuals, leading to improved awareness and less chronic disease in this parish. The next primary driver is to increase effective information delivery that leads to increased understanding of chronic disease and the resources available in East Baton Rouge Parish to help address or prevent them. In order to reach this objective, the implementation plan is to create a web-based database with programs available about diabetes and hypertension, to support faith-based organizations and increase the number of health ministries, create a database of resources for the development of effective health ministries, to create resources and best practices for delivery of health information to support organizations who hold health fairs, and to streamline messages around diabetes and hypertension using toolkits and educational programs. To the right of this chart, you will see the partners associated with each of these secondary drivers. This objective relates to the overarching goal of this implementation plan because in order to improve health, it is crucial to educate the public on chronic diseases. Through these actions, accessible information on ways to overcome chronic disease will be offered by providing a variety of educational and interventional outlets. The web-based database, health ministry and health fair support, streamlined messages, toolkits, and educational programs will all improve information delivery to decrease chronic disease. The third primary driver of this priority area is to increase the knowledge around smoking, vaping, and dipping. In order to reach this objective, the goal is to provide prevention education to parents and students, to promote tobacco education and cessation by utilizing the media such as ads, posters, etc., including all community partners and stakeholders. And lastly, to increase the number of people served in elementary, middle school, high school, and college on tobacco awareness, paraphernalia, and vaping education. The right column of this chart shows the partners associated with these secondary drivers. This objective relates to the overarching goal of this implementation plan because smoking prevention and cessation resources will result in healthier lifestyles. By educating children, adolescents, and parents on the chronic conditions associated with smoking and increasing smoking cessation projects, overall health of the community will improve. Collaboration with schools and stakeholders is crucial considering the use of novel vaping products at young ages. The last strategic objective associated with the Healthy Living Implementation Plan is to promote health in all policies. The secondary drivers to reach this objective include to support healthy workplaces and to promote healthy drink choices for kids. The right column of this chart shows the partners associated with each of these secondary drivers. This objective relates to the overarching goal of this implementation plan because the promotion of health-related policies is important in order to reach additional niches in the community. By collaborating with corporations that have large workforces and increasing child-related nutrition interventions, efforts to decrease chronic diseases will improve. Adult workplace wellness allows for convenient access to reliable nutrition information and support. Additionally, reducing the consumption of sugar-sweetened beverages at a young age promotes healthier choices lifelong. Next, Sydney will be speaking on the progress made in each of these objective areas.
Thank you, Amy. This is Sydney, and I'll be going over the progress. Primary driver one, increasing physical activity and healthy meal preparation and consumption through a healthy family campaign. Healthy BR Family Fit Day provides fitness classes, healthy food tastings, bike rides, runs, walks, and physical fitness competitions. It's sponsored by Healthy BR and it is a street style event at B-Rex City Brooks Park. BREC has expanded bike and walking trails to 59.23 miles throughout East Baton Rouge Parish, and BREC on the Go provides physical activity to play deserts in East Baton Rouge Parish, and it is a pop up shop concept to bring physical activity to the play deserts. 5210 plus 10, the message and curriculum was created by Healthy BR and Our Lady of the Lake Children's Hospital, and it teaches the importance of fruit and vegetable servings, recreational screen time, physical activity, and sweetened beverage consumption, and adequate sleep. The second primary driver, increasing effective information delivery that leads to increased understanding of chronic disease and the resources available in East Baton Rouge Parish to help address or prevent them. There's a healthy BR partnership between Baton Rouge General and the American Heart Association, and it sponsors a teaching garden and it educates kids about food sources, the importance of fruit and vegetables, and the value of being active in the prevention of chronic disease. The Big River Economic and Agricultural Development Alliance manages the Red Stick Farmers Market and the Red Stick Mobile Market, and they both play an important role in obesity prevention, and they provide the fresh from the market cooking demonstrations, educational displays, and fitness activities. The third primary driver, increasing the knowledge around smoking, vaping, and dipping. There has been tobacco free and smoke free environments implemented by local hospitals, and BREC parks. There's free smoking cessation assistance provided by the Smoking Cessation Trust that also partners with local hospitals and clinics. There's secondhand smoke prevention provided by local hospitals and Healthy BR on the Smoke Free East Baton Rouge Parish Coalition. And this initiative was designed to protect employers, musicians, and entertainers in bars and casinos from secondhand smoke. And it was passed by the East Baton Rouge Parish Metro Council, and it banned smoking in all the previous businesses mentioned. And that was effective on June 1st, 2018. The fourth primary driver, promoting health in all policies. Pennington created a toolkit to assist primary care providers in preventive and treatment services for childhood obesity. The toolkit can be found at the link provided. Pennington also partnered with the Mayor's Healthy City initiative to identify community strategies to improve children's behaviors to prevent obesity. And now Viviana will take over and discuss the improvements.
So, in order to suggest additions and improvements to the implementation plan, I wanted to look over our goals from the first slide to help analyze the purpose of the existing implementation plan. The goals aim to increase knowledge of chronic diseases, implement healthy lifestyle changes, and improve knowledge and access to healthier foods, meals, and physical activity opportunities. These all contribute to the overarching goal, which is to decrease the prevalence of chronic disease in the East Baton Rouge Parish by creating healthier communities. In the CHNA, the healthy living category not only includes eating well, being active, and not smoking, as stated on page 21 of the CHNA, but it also focuses on diseases such as cardiovascular disease, stroke, diabetes, as seen on page 25 of the CHNA. This makes sense because living a healthier life through diet, exercise, and decreased smoking for those who smoke would potentially contribute to a decrease in the prevalence of chronic diseases such as stroke, diabetes, and CVD. Given that the promotion of healthy living in the East Baton Rouge Parish focuses on eating, physical activity, and smoking, a strategic objective that focuses on the nutritional aspects would point towards promoting the healthy eating portion in the community through an increase in availability, knowledge, and skills to encourage the overarching goal of decreasing chronic diseases. To report on suggestions to improve or additions to be made that incorporates nutritional aspects would include an improvement of one of the strategic objectives already mentioned that aligns back to the overarching goal. To build upon strategic objectives 2 and 4, it would be advantageous to promote nutrition education and healthy eating habits to community members on the prevention of chronic diseases such as CVD, diabetes, and stroke through healthy eating habits. Some of the nutrition tips and focal points of the education on each chronic disease would include advice on eating habits for CVD, stroke, and diabetes, respectively. So from the American Heart Association, they would encourage to incorporate a variety of fruit and vegetables, either fresh, frozen, canned, without added syrups, and to replace high-calorie foods with fruits and vegetables. They also encourage a fiber-rich diet with whole grains, an increase in low fat or skim dairy versus whole or high fat dairy, poultry that is skinless, fish, which has a variety of omega-3s at least 2 times per week, an increase in nuts and legumes, and non-tropical vegetable oils. Also, a limitation of saturated fats, trans fats, sodium, red meats, sweets, and sugar-sweetened beverages are encouraged. For a diabetic diet, the American Diabetes Association would point towards the diabetes plate method, which incorporates half of the plate with non-starchy vegetables and a third of the plate with protein like fish or meats, and the other third can be carbohydrate foods. More education could also be on carb counting and nutrition labeling. So all of this information could be a lot to take in on one flyer or educational session. So an action plan that incorporates a gradual education implementation in the work environment will be explained further. So an action plan related to nutrition and dietetics not previously mentioned in the implementation plan would focus upon a free education plan on the 3 aforementioned chronic diseases and healthy diets that combat them. To begin an action plan, it is important to answer the following questions like, what is it that your community wants to accomplish? What needs to be done by whom and how will it be done and by when? What resources like money or people are needed to be successful and who will be most effective? To answer the first question, the plan would increase the availability, knowledge, and skills in the eating habits of working adults. RDs could create education plans and collaborate with the ADA and the AHA. These education plans could include a series of either in-person meetings or videos given during an offices or businesses work meetings that give a quick and easy 10-minute education on eating patterns, habits, and the relation to the chronic diseases, respectively. Funding would be through organizations to create some education materials and flyers and pamphlets to give to the staff. The leaders in the staff would be the most effective and hopefully grow in knowledge and skill in nutrition after the educations. For the marketing strategy, a free education plan for work environments would cover chronic diseases and the prevention of them. This would be advertised through the Healthy BR, ADA, or AHA websites. To increase awareness of this implementation, nutrition professionals could hold workshops at seminars or conferences on this implementation plan. As mentioned earlier, videos could be created and posted on YouTube for easy access, and on YouTube or other web platforms, staff could come ask questions and communicate with the RDs involved, which would provide opportunities for further communication on healthy living. So in summary of all of our slides, the strategic objectives are centered around 4 primary drivers to meet the goals for this priority area, which include increasing physical activity and healthy meal preparation and consumption through a healthy family campaign, an increased effective information delivery that leads to increased understanding of chronic disease and the resources available in each Baton Rouge parish to help address to prevent them, increase the knowledge around smoking, vaping, dipping, and promote health in all policies. Through the progress, physical activity, and healthy meal preparation and consumption through a healthy family campaign were discussed, as along with information of about the delivery of chronic diseases and resources that are available. Also, again, smoking awareness and prevention of health policies. And as far as additions and improvements go, I focused on the availability, knowledge, and skills so that residents can prepare and eat healthier foods and meals and decrease prevalence of chronic diseases. And through that, creating a free education plan suited for the work environment that cover diets for prevention of chronic diseases such as diabetes, VD, and stroke were discussed. These are our references. Thank you so much.